Welcome to another edition of the Cancer Awareness Month here on the Super Morning Show on Joy 99.7 FM. Professor Antwi Oppong returns to the show this morning. Yesterday, he took us through cervical cancer, and a lot of you have sent us a lot of feedback. You've learned a lot of new things about cervical cancer. Prof is taking us into ovarian cancer today, and he's going to educate us about ovarian cancer, which has been called the silent killer. Why is it the silent killer? What are the symptoms? How is it treated? How is it diagnosed? Prof is going to share all that with us this morning here on the Super Morning Show. Welcome back to the conversation, Prof.
Thank you very much, Kojo. And good morning to our listeners.
And I hope you are well. We got a lot of feedback on the conversation on cervical cancer. And there are people who said, based on our conversation, they are going to go and get the various screenings done so that together, and some parents also sent in messages that they were not too sure about the HPV vaccination. But after you explained everything, they have a strong reason why their girls, their daughters should be screened. Thank you so much for the knowledge on cervical cancer, Prof.
Thank you. I'm happy that programs such as this is making impact and hopefully should positively influence the lifestyle and health-seeking behavior of Ghanaians everywhere. Thank you.
Great. Today, our conversation is on ovarian cancer. And in my readings about ovarian cancer, it's been described as a silent killer. What is ovarian cancer and why is it called the silent killer?
Well, yeah, thank you once again. And yes, ovarian cancer has been described as a silent killer simply for the fact that unlike some other cancers that manifest early, and therefore doctors are able to diagnose them early and treat, for which reason the outcome tends to be good. Ovarian cancer, on the other hand, the diagnosis tends to be late, simply because the early signs and symptoms of ovarian cancer mimic very common everyday ailments. And therefore, people don't think about it and until it is late. And therefore, most of the diagnosis, like I mentioned, is made late. And for every cancer, once the diagnosis is made late, often the outcome is not good. Yeah.
So it's difficult to diagnose ovarian cancer.
Compared to other cancers, yes, ovarian cancer is more difficult to diagnose.
Why is this so? Have you not developed any screening or diagnostic processes or procedures for this?
Diagnostic tests are available, but the difficulty is that unlike some other cancers that, for instance, you can screen and detect it at the pre-cancer stage, there is very little to do to be able to detect ovarian cancer when it is developing until it has become a full-blown cancer. And even when it has become a full-blown cancer, the early symptoms, like I said, they mimic very other common ailments. For instance, if a woman goes to see a general practitioner and says, well, I feel like I have a lot of gas in my tummy. I belch a lot these days. When I eat spicy food, I get these heartburns. Nobody is going to think about ovarian cancer unless she has some critical risk factors. And therefore, this woman is likely to be given something to relieve the discomfort in the chest or the abdomen. Sometimes they may even go to general surgeons. They will suspect that is gastritis, that is irritation of the stomach, or even peptic ulcer, and subject them to a lot of endoscopies. But some of these symptoms may actually be related to ovarian cancer. So it's the common reason why the diagnosis is made late. And it's not only in our part of the world where sometimes we blame ourselves for not having all the big gadgets or the latest gadgets for investigations. Even in the Western world, diagnosis of ovarian cancer is often made late, unless there is a high sense index of suspicion, maybe based on the experience of the doctor or the peculiar risk factors that a woman or an individual will have. Nobody will usually think about ovarian cancer at the early stage.
Wow. So we need to be very careful with this silent killer. Now, what exactly is it and how common is ovarian cancer? And also, are there different types of ovarian cancer?
Yes.
Yeah.
You ask a lot of questions, almost like a full essay on ovarian cancer. Okay, so what's ovarian cancer? Like I mentioned yesterday, the ovary is part of the reproductive organs of the woman. So the ovary is where every woman produces an egg, usually after menarche or after puberty, till the woman gets to menopause. The ovary is expected to produce an egg or two, very rarely, from either of them once a month. And that egg is what combines with the sperm to fertilize before a baby is born. Now, that organ, the ovary, there are two of them in every woman. And in addition to producing the egg, it can suffer several other ailments in the course of the life of a woman. I mentioned yesterday that nearly every organ in the human body can develop cancer. Of course, some are more common than others. So the ovary, like any other organ in the human body, can also become cancerous. Are there different types of ovarian cancers? Yes, there are. The ovary, though, is one organ, is made up of different cell types within the ovary. And each of the different cell types within the ovary, at least about 4 groups of cell types within the ovary, each one of them can develop a cancer along its own lines. Is ovarian cancer common? It's relatively common. In Ghana, based on some studies that were done at the Korle-Bu Teaching Hospital several years ago, it's about the third commonest cancer among women who come with gynecological cancers.
Wow.
So yes, it is quite common.
So I guess breast cancer will be number 1, cervical number 2, and then ovarian number 3.
Ovarian, yes, about number 3. Yes.
Who is most at risk?
Well, maybe let's find out whether there is a cause to it, like we did for cervical cancer yesterday.
Yes, Prof.
So there is no direct known cause for cancer of the ovary, unlike what we have for cervical cancer. However, there are certain factors that make one that increases one's risk of having ovarian cancer or not. One of the commonest risk factors is family history. And in fact, up to about a little over 15% of all ovarian cancers, we say they are familial, in that there will be a family history of somebody who has had ovarian cancer. However, for the remaining 85% or so, we say their development is sporadic, meaning that you may not be able to trace any family member who may have had it. It just arises. The question is, what makes ovarian cancer come about in an individual? Like I said, we don't have any known direct cause, but there are certain factors that increases one's risk. One of them has to do with reproductive lifestyle or reproductive habit of an individual. It's not anything that anybody has created. But for instance, we know that women who have fewer pregnancies or never had pregnancy at all tend to have higher risk of developing ovarian cancer compared to those who have had several pregnancies.
Interesting.
Maybe it's because when you are pregnant, the ovary doesn't continue to develop eggs. At least for the period that you are pregnant and breastfeeding, the ovary becomes, if you like, quiet or silent. And that sort of reduces one's risk. Again, we know that women who do not breastfeed are at higher chance of developing ovarian cancer than those who breastfeed. So here, breastfeeding becomes a protective factor. Women who may be taking certain medications to enable them ovulate rapidly, either in a form of assisted reproduction or others, may also have a slightly increased risk of developing ovarian cancer. Years ago, we used to think that exposure to certain substances like talc that you find in powder, asbestos, and other things also increased a woman's risk of developing ovarian cancer. However, the evidence from that source seemed to be diminishing. So now we don't talk much about talc exposure and all those things. So just to recap, the critical things are family history or genetic predisposition. And when it comes to genetic predisposition, there is a certain inherited gene mutation or changes within the gene that increases one's risk. And that same gene also increases a woman's risk of developing breast cancer. So often we say that women who have family history of breast cancer, cancer of the intestines, and cancer of the ovary often share something in common. Then I've also mentioned the reproductive factors. And just to add that there are some other reproductive practices, for instance, use of oral contraceptive pills, and even sterilization as a form of contraception for women have all been known to protect women from developing ovarian cancer. So these are some of the known risk factors.
So, Prof, if I get you very right, then it means that if we are to prevent ovarian cancer, for example, using birth control pills prevents the ovaries from doing from carrying out their regular function. So it helps to prevent ovarian cancer. Pregnancy also prevents the ovaries from the monthly cycles. So it also helps to prevent ovarian cancer. Breastfeeding, which becomes an after activity of pregnancy and childbirth, also helps to prevent ovarian cancer. Right.
Precisely.
So these are things we can do to prevent ovarian cancer. Are there any other ways we can prevent it?
The risk, reduce the risk of ovarian cancer.
Okay.
Yeah.
Now, you mentioned earlier that the reason why we call ovarian cancer as a silent killer is that it's difficult to detect it. And usually we find it at a very later stage. Are there symptoms we should look out for? Who should prompt us to get checked and to get help?
Okay. So there are symptoms we should look out for. But for purposes of education, I think, first of all, we should know our family history. Unfortunately, in our part of the world, we seem not to be so much interested in what is causing the ailment or the death of a family member. Family history, as I mentioned, family history of ovarian cancer, family history of breast cancer, family history of cancer of the large intestines are very important. So if anybody has a family member that has suffered any of these things, it's important to know for yourself. So that should you begin to develop any of these symptoms that I'm going to talk about, maybe you begin to take them seriously. Remember, I started by mentioning that a lot of the early symptoms are quite common to other common ailments. And these include excessive belching, feeling bloated, heartburns. We say early satiety. You eat small amount of food, you feel full. I am not saying that when you have any of this, it means you have ovarian cancer. I'm just mentioning that the early signs or symptoms of ovarian cancer mimics these symptoms that I've mentioned. Then also, you begin to notice that your tummy is becoming large for no good reason. By the time you get there, probably the disease is becoming advanced. Then occasionally, you may feel vague abdominal pain. Beyond this, when the disease has spread to involve other organs in the abdomen or the ovary has become so enlarged, then it may compress on the intestines. So the woman may now begin to have constipation.
I see.
Sometimes associated with vomiting. And I'm sure by that time, the tummy has become so bloated that anybody who knows this woman would know that definitely there is something wrong with her. At that stage, they begin to lose weight. But this weight loss is there in spite of the enlarged abdomen. So yes, the woman's abdomen is enlarged, but the rest of the body, you can see that she's becoming emaciated. Maybe at that stage is a bit too late. Then pain in the abdomen. When the abdomen becomes so distended, sometimes they become even breathless. They can't even lie down flat and sleep, because the moment they lie down, they become breathless. At that point, there's probably so much fluid accumulation in the abdomen, and that's what makes them breathless. Sometimes this fluid may extend even into the chest, and there'll be fluid accumulation in the lungs. And at that stage, again, they begin to cough, they become breathless, and all manner of things. These are all late signs or symptoms of ovarian cancer.
But you said earlier that these symptoms are also common for many conditions. So my guess is that if somebody persistently sees these symptoms, then they should be worried. For example,
Yes,
if you feel full quickly when eating, maybe sometimes because of inactivity and all those things. But if it becomes consistent, then you should go and get yourself checked.
exactly. And more importantly, if you've had these symptoms, you've gone to see your GP, they've given you something for gas, and it's not going away. You complain, they say, we'll go and do endoscopy. They do the endoscopy, they probably didn't find anything. I think you should be gravitating more towards a gynecologist. Because when you go to the gynecologist with these symptoms, he or she is likely to think more towards ovarian cancer. But if you go to a GP all the time, they will manage you for the common symptoms of these, upper gastrointestinal disorders.
Wow. Now, Prof, I also want to get some other things straight, because you've mentioned so many things. So usually when you speak, I take my notes and I want to be sure I'm taking the right notes. So for example, for the risk factors, you mentioned that family history is one of them. If the person has had personal history of breast cancer and cervical cancer or any other cancer, the person should.
I didn't mention cervical cancer, so I said breast cancer, colon cancer.
Colon, yes. Colon
cancer of the large intestines. Either the person has had some in the past or a close family member had some. These are all important.
And he said things that help to lower the risk. Pregnancy is one, breastfeeding is one. So I want to assume that if somebody has never been pregnant, it's a risk factor.
Yes, that increases her risk more than somebody who has had a number of pregnancies.
And I want to make another inference. You said that when people, when the ovaries don't do their regular job, it helps to reduce the risk. So if somebody say before menstruation, the risk is very low. after menstruation, maybe after menopause, does the risk reduce after menopause, for example?
The risk doesn't necessarily reduce after menopause, but your cumulative risk during your lifetime remains the same.
Okay.
Even though we know that ovarian cancer tends to start relatively early, and most women with ovarian cancer that we see, they have the disease before they get to menopause. Even though, yes, some will also develop ovarian cancer well after menopause.
Okay.
Let me also say that there are also some type of ovarian cancers that occur in young people, typically below 25, 30 years. Those type of ovarian cancers don't have these typical risk factors that I'm talking about. Usually, they start from a different germ lines or cell lines. But the classical and common type of ovarian cancers that we have are the ones that we have described as a prototype.
I have my niece I care about so much who has had one of her ovaries taken, and she's under 30. So this thing you just said just reminds me of her experience and how together, if we learn more about these things, we can protect our women and our girls. Now,
Precisely.
Prof, are there any other risk factors aside the ones you've mentioned?
I'll say by and large, these are the common risk factors. For the ovarian cancers that occurs in children, occasionally we may have some sporadic genetic disorders that may occur in these women which make them develop this, what we call the juvenile type of ovarian cancers. Unfortunately, these are not things that you can predict.
I've also heard about BRCA genes and their connection with breast and ovarian cancer. What is that?
Okay. So remember I mentioned that about 15% of ovarian cancers are genetic or familial. And these are the cancers that occur as a result of what we call a mutation in the breast cancer antigen. So the BRCA 1 and 2 is what we refer is stands for the breast cancer antigen. Okay. Now, people who develop the 15% of people whose cancers are familiar, it is as a result of inheritance of abnormalities in these cancer genes. And there are certain populations in which the inheritance of this cancer gene is so common. And among those people, they tend to have a lot of those cancer gene mutation related cancers. Unfortunately, it's not so common in our part of the world. Okay. But occasionally, we've come across families where, yes, we've identified mutation in these BRCA genes. And this same gene is responsible for breast cancer, like you said. They are responsible for some form of colon cancer, and they're also responsible for ovarian cancer.
And can we test for these genes in Ghana?
Yes, we can. Now we are doing quite a bit of genetic testing in Ghana. If you go to the right lab, I'm sure they'll be able to test. If they are not able to even run the test for you in Ghana, I mean, these days we're able to send sample outside and you can get test results sent back to you.
Professor Samuel Antwi is my Samuel Antwi Oppong. Professor Samuel Antwi Oppong is my guest this morning. We are talking about ovarian cancer. We're going to use the next 5-6 minutes to run through diagnosis and treatment. Prof, how do we diagnose ovarian cancer and what treatment options are available in Ghana?
Right. So the diagnosis is first of all based on the history and the examination findings. The history, I've mentioned some of the risk factors and I've mentioned some of the symptoms as well. So in an appropriate woman with those symptoms and signs that we've mentioned, then we do other additional diagnostic tests. Often the first line test is ultrasound. Ultrasound these days is used for a lot of things, and we as gynecologists and obstetricians use ultrasound a lot. So ultrasound can actually show you, or through transabdominal ultrasound, you can actually visualize the ovary. So you know whether the ovary is enlarged. You know whether the enlargement is related to only one or both ovaries. And you can also see some other characteristics of the ovary that will tell you whether it is likely to be cancer or not. Then, secondly, there's something we call tumor markers. These cancers produce certain chemicals that when you are able to test for these chemicals in the blood, it gives you an idea whether an enlargement of the ovary you are seeing is likely to be cancerous or not. Let me say that the chemicals themselves alone don't make a diagnosis. We use these chemicals as an adjunct to an enlarged ovary to make the diagnosis. And sometimes we also use these chemicals to monitor the response to treatment and to be able to predict whether a treatment outcome is going to be good or not. So the chemicals are very useful. We call them tumor markers. And there are different tumor markers from different types of ovarian cancers. So that's something to note. Whilst we are at diagnosis, let me be quick to add this. It is not every enlargement of the ovary that is cancerous, because we've had instances when young ladies have gone to do ultrasound, who are otherwise well, have gone to do ultrasound for other purposes. And then the sonographer or the doctor sees a swelling or a cyst on the ovary, and heaven breaks loose. You are going to have ovarian cancer. People have taken very radical actions because of the fear of ovarian cancer. But let me add that it is not every swelling or enlargement of the ovary that is cancerous. So please, people should take their time to interpret enlargement or swellings of the ovary carefully without causing unnecessary panic. Beyond the ultrasound, sometimes we may also step up to do a CT scan or MRI. But these are not so critical. Very often we don't use them. The ultrasound is the main thing. Then you add the tumor marker to it. With these two, there's a lot of information that we can gather related to ovarian cancer. Let me say that even when we strongly suspect ovarian cancer based on the ultrasound and the tumor marker, the definitive diagnosis of any cancer is based on taking a tissue and sending it to the pathologist for the pathologist to examine for you to confirm that there are cancer changes in there. So that biopsy and histopathology examination is very critical before a definitive diagnosis of any cancer, including ovarian cancer, can be made.
I see. But Prof, with colorectal cancer, for example, we know you can pass a probe through the duct and check. And I know the ovaries also are connected to the womb and the other parts of the female reproductive organ by the fallopian tubes. Can't we pass any probe into these things to check for ovarian cancer?
Unfortunately, no. A lot of attempts have been made, for instance, to use ultrasound assessment and this tumor markers that I mentioned to see if we can screen and detect who is about to develop ovarian cancer. Unfortunately, this hasn't worked. And it's a reason why ovarian cancer remains a silent killer and diagnosis is often made late. So one of the biggest challenges we have with ovarian cancer is absence of an effective screening tool. Like colon cancer, like you mentioned, yes, you can do endoscopy and they'll be able to screen and take biopsy and tell you that you are likely to develop something. Ovary, on the other hand, we cannot.
I see.
Cervical cancer, we talked about yesterday. There is a lot that we can do to screen for cervical cancer. Unfortunately, we can't do same for ovarian cancer.
Wow. 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 Silent killer indeed. But what are the treatment options?
So the treatment options vary depending on the stage. But by and large, the first treatment modality is surgery. And the type of surgery that will be done depends on the stage of the cancer. Very often, if you have early stage ovarian cancer, surgery may be able to cure the disease. But beyond a certain stage, yes, you can have surgery, all right, but the surgery alone will not be enough. Then beyond surgery, the next line is chemotherapy, where we use drugs to treat. Very rarely, you may also use radiotherapy, especially when you have recurrent disease located in specific part of the body. Some form of radiotherapy may be tried, or a combination. Now, in ovarian cancer, there is new development towards immunotherapy and what we call targeted therapy based on the genetics of the individual. So they can come up with new molecule that may be able to treat a patient X based on her genetic makeup. But the moment we go there, we are talking about more advanced, and most of these treatment modalities are not available to us on this part of the world.
Now, Prof, what are some of the outcomes after treatment? Are we getting good survival rates? Are patients able to recover and get back to normal?
It's a big question. Ovarian cancer, generally, we say survival rate tends to be very low. In fact, even in the best of hands in the Western world, for advanced ovarian cancer stage 3, stage 4, 5 years survival, probably just around 30%. What we mean is that if 100 women are diagnosed with stage 3, stage 4 of ovarian cancer, probably just about 30 of them will be alive in 5 years' time. So it means that a lot of them die. In our part of the world, the numbers are probably worse than it is, for the simple reason that many of the patients are not able to afford the most effective treatment. So they start the treatment and they abandon along the line because the drugs are expensive. They are not able to even treat the side effect of the treatment. Remember that cancer treatment sometimes can be associated with a lot of side effects. And if you don't manage the side effect well, sometimes you may even succumb to that one. There are a lot of them too who, even after surgery, can't even afford the chemotherapy. So you've done beautiful surgery, but you let the woman know that, look, we've done the best that we can in terms of surgery, but the disease has reached a stage where it is not surgically curable. You will need chemotherapy to continue. The woman goes home 3 months, 4 months, you don't see her. They only come back with the disease having recurred or advanced, and they just come and die. So this prognosis, I'm talking about 30% for advanced disease, is probably much worse than we have in our part of the world. But having said that, we still have some cases of survivors. And I have had women who have lived more than 5 years, sometimes even after treatment for advanced disease.
I was going to ask you another question, but based on what you just said, I just want to shelve that question because I know that sometimes in treatment, you take out the ovaries, the fallopian tubes. There have been instances where the uterus is also taken. The womb is also taken. And I was going to ask, in cases where you take the ovaries and fallopian tubes, for example, can the womb still be used maybe by artificial insemination for the patient to have a child if they so wish? But based on the survival numbers you are giving to me, I don't want to ask that question.
All right.
But I asked it anyway. If you want to answer, you can have some 30 seconds to answer that.
I must say that fertility preservation in women with ovarian cancer is a rarity. Very few cases can you preserve the womb for any form of pregnancy or anything after that. So the simple answer is that it is very rare in our part of the world, simply because the case is coming late. And most of our surgeries involve clearing everything in the pelvis.
Prof, let me wrap up with these notes I've taken, and I want you to tell me whether I got it right. That ovarian cancer is very difficult to detect early. So we should all be minded and listen to our bodies. And if we see any persistent symptoms like the symptoms you mentioned, we need to talk to our doctors. If you are talking to a GP and it goes on consistently, maybe you have to talk to a gynae. Now, we need to seek evaluation for concerning symptoms. And you mentioned the bloating. So sometimes you are bloating, your stomach is bloating, but you are losing weight everywhere. It's a symptom that is concerning that you must check on. And then family history is also very important. So all women should know their family cancer history immediately. We should be talking to our parents, parents, our aunties, to know our family's cancer history so that we'll know our risk level.
That is true. Let me add that in a part of the world, families don't like post-mortem examination. Sometimes doing the post-mortem will let you know what the cause of death is. And anytime a family member dies from a cancer of a sort, yes, we know that as Africans, we like to shield or protect the dead, so we don't say anything about the dead. But it's important that we share this information with those who matter and need to know. Otherwise, we'll think we are preserving the dignity of the dead, but we may actually be sacrificing the living and their future.
Wow. So when we think we are preserving the dignity of the dead, we should know that we are sacrificing the living and their future.
Exactly.
Wow. Thank you so much, Prof. Thank you so much for the past 2 days talking to us about cervical cancer and ovarian cancer. Prof. Samuel Antwi Oppong, Prof, is an OB and gynae with the Korle-Bu Teaching Hospital. He spent 2 days with us here on the show to talk to us about ovarian cancer and cervical cancer. Thank you so much, Prof. But before I let you go, any final words for listeners?
I think we should make use of the kind of information that we come across, and I think Joy FM is doing a fantastic job in the month of October. Let us all enrich ourselves with this knowledge and take the necessary action that will improve our health overall. Thank you.
Professor Samuel Antwi Oppong, thank you so much. And before I go, I'd like to remind you that while ovarian cancer is challenging to detect early, we should listen to our bodies. Okay, our women, listen to your bodies, and the men, help the women to listen to your bodies. Watch out for changes, watch out for the symptoms, and help them seek health care and advice. Persistent, new, or worsening symptoms deserve medical attention and evaluation. Know your family history. If you have a strong family history of breast or ovarian cancer, discuss genetic testing with your doctor. And while this is a serious cancer, we need to create awareness together and give prompt attention to the symptoms so that we can make a difference together. Thank you so much, Prof, for joining us on this edition of the Cancer Awareness Month. My name is Kojo Akoto Boateng. This has been the Cancer Awareness Month with Professor Samuel Antwi Oppong. The Super Morning Show continues. Stay with us.